CNN showed recently its lowest rating since 1991.
Well, look at what they did with you with the vaccines. And I don't know if you saw now, two different articles in the last 60 days probably. One is that people who have been vaccinated multiple times over, I think, the age of 60 are at an increased risk of being hospitalized with COVID was one of the articles.
Yeah.
And then the other article was that two of the heads of the FDA that approved the vaccines now went to go work for Moderna. In the last 40 years, the last 40 years of the FDA, two heads of the FDA have not gone to work for industry. Two.
Only two.
That's nuts. That's insanity. And so, and that's the same thing that was happening at the DOJ. And that's why I wanted to bring up the DOJ. And as well, even though that they have nothing to do with the peptides, they are part of the healthcare industrial complex inadvertently, because they're being used as an attack dog by the big insurance companies. And all it takes is one orthopedic surgeon getting indicted for something, or one general surgeon getting indicted for something, for everyone to go, fuck that. I'm done. I'm not doing that test. I'm not doing a genetic test. Like, no way. And now insurance doesn't even cover any of those tests. And so they're going to force anything out of the marketplace with time. But in the short term, they're going to run their offense. And that same level of spit that's being swapped at the FDA is being swapped at the DOJ. So the big insurance companies attempt to recruit away DOJ prosecutors. And once they've built their reputation in working as a steward for the people at the Department of Justice, and they put some big hides on the wall and build a name for themselves, they'll get recruited to private industry. And one of the big options for them is to go work for the insurance companies, including the FBI agents. So most of the, and I say this because I don't think the average clinician in America even understands. When you have a insurance special investigative unit show up at your practice, which happens. So if you run a lot of blood tests, or you do a lot of genetic tests, or you do anything that the insurance company thinks, man, this guy's doing these tests, I don't want him doing these tests anymore, there's a chance that they send an auditor, and that auditor is a special investigative unit. And that guy is typically a former FBI agent that worked for the federal government, who still has all those connections at the office. And so there's just so much cross-pollination. And again, it's not me saying the DOJ is bad or the FDA is bad.